32 weeks feels like such a big milestone, especially for me personally. I gave birth at 34 weeks with my first child, so this is a really exciting video for me to film. Is 32 weeks pregnant. In this video, I'm going to talk all about the different appointments I've had and appointments I have upcoming, some symptoms I'm experiencing, as well as little tidbits of advice that I have found that work well for me. If you're new here, hi, my name is Jenny. I am a teacher, mom, and doctoral student expecting baby number 2 in July. I am currently 32 weeks pregnant, and I figured I would do my 32 weeks pregnancy update to see how you all are feeling if you are also pregnant, or if you're going to be hitting 32 weeks soon, maybe something that you can expect in the future. The first thing I wanted to talk about was some previous appointments that I had. So when I was at 30 weeks, I actually went to my high-risk OB, my perinatologist. Some people also call them a maternal fetal medicine doctor. So I saw my high-risk OB, and they were checking to make sure that my cervix was still measuring long to ensure that I wasn't going into preterm labor. If it had measured shorter than they wanted it to, then what they would do is they would give me a progesterone shot to try to help prevent that premature labor this time. Luckily for me, when I went to my appointment, I did not have any signs of my cervix shortening. Yay! I'm very excited. So I actually graduated essentially from my maternal fetal medicine doctor. What that means is I don't have to go back to them. Basically, I just see my regular OB now, unless my regular OB notices something unusual or odd that they need to check in with. So I'm actually done with all my appointments with my maternal fetal medicine doctor, which is great, obviously, that I've been cleared to just see a regular OB, but also a little sad because he was so nice, and it was nice to be able to see my daughter every single time I went because they always do an ultrasound. I also recently had my 32-week appointment. So at my 32-week appointment, they basically just went over how I'm feeling and had me fill some things out. I also got my Tdap shot. So Tdap you actually are supposed to get in your 3rd trimester, and the Tdap shot basically is a shot that you get for every pregnancy. So even if you've had it, you're going to have to get it again, and it's basically to give baby antibodies to prevent whooping cough. Whooping cough is a very serious and scary illness that a baby can get, so it is really important, if it's something you're willing to do, that you do get the shot. I will say the shot itself did not hurt at all. My arm's a little sore now, but other than that, the shot doesn't hurt at all. And I got it for my first child. I'm getting it for this one. It's a bummer to have to get extra shots. I'm a big baby. I don't like getting shots, but you know what? I don't want my child to die from whooping cough, so for me, it was well worth it. So something you could expect around your 32-week appointment is getting that Tdap shot. If they don't offer it to you, ask for it. I actually had to ask for mine, and they were actually really surprised. They were like, "You haven't been offered it yet?" I said, "No, please give me my Tdap shot. Thank you very much, because I don't want to deal with whooping cough." It's really sad. If you look up a video of a baby with whooping cough, I feel like that's usually enough to convince you that getting it one more time is worth the shot. Okay, so we've talked about my previous appointments. Let's talk about my upcoming appointment. My next appointment will be at 34 weeks. So I'll go back every 2 weeks now until I hit, I think, 36 weeks. But 34 weeks is my next appointment. So I'll be going, I'm actually seeing one of the midwives this time, and they're just gonna check my blood pressure, make sure everything is looking good, measure baby. I'm measuring exactly where I'm supposed to be. Even though I feel enormous like a beached whale, they say that I'm measuring exactly where I should be. Baby is head down, which is great. So if I go into labor before my C-section date, I am gonna go for a VBAC, which is vaginal birth after cesarean, and see if it works out. And if it doesn't, that's okay. I'll do a repeat C-section. 34 weeks is gonna be a big appointment for me because, like I said, with my first child, I actually went into labor, my water broke at 34 weeks. So I'm actually starting to bite my nails a little bit in terms of being at this point in a pregnancy. I'm really, really hoping I can make it at least to 37 weeks. If you're in the same boat as me and you had preterm labor before and you're trying to make it just that extra bit, I am thinking of you because I know how stressful it is and how I'm trying so hard to keep calm so that I don't go into preterm labor again. Speaking of keeping calm, let's talk about some symptoms now. The first symptom that's cropped up lately, and I don't know if this is just end of school year stress or what, but I've been a lot more stressed than normal, like way more stressed than normal. Irritable, stressed out, having moments of just like intense anxiety, and that hasn't been the case for me for the rest of my pregnancy, so it's a little unusual. I did have a little bit of postpartum depression with my first pregnancy, so it's not something that I wouldn't be surprised by, but for me, I've been having a lot of issues lately with just being really anxious and stressed, and every little thing seems to be just like a lot more serious than it really is to me. So I don't know, are you having those feelings? Is it just me? Is that a thing? I know that I'm gonna probably talk to the midwife about it to see what can be done, or if there is anything that needs to be done. I'm really trying to wait until after I deliver to really take any extra medications, but if it's needed to keep me healthy, then you know, that's a road that I'm gonna go down. But if you're feeling that way, I would love to know, because I didn't feel like this with my first pregnancy, and this is something a little bit new and different for me. But I've been really stressed and irritable and on edge about a lot of stuff lately that I normally wouldn't be. Another symptom that I continue to have, which is not really surprising, is insomnia. I've had so many issues with sleeping. A lot of it comes down to the fact that falling asleep is tough, staying asleep is tough. If I don't have to get up the following morning, I'll take a half dose of a sleeping pill. I think it's 25 milligrams. I'll put the name of the one that I take over here, but I take a half dose of it just to help me fall asleep. It doesn't make me groggy, which I appreciate, because a lot of medicine that is a sleep pill makes me feel really groggy, and I don't like feeling that way, so I don't like to take it, but I gotta get sleep. So however I'm getting sleep right now is what I'm doing. So I try not to take the medicine every night, but I need it. I can't fall asleep without it. So I take it maybe 3 times a week or so, just to make sure I'm getting some sleep. So as far as the sleep problems go, they go hand in hand with the next 2 symptoms that I've been having, which are pretty intense hip pain, which again, not unusual to have hip pain, but basically every time I turn from one side to the other at night, I have that hip pain. I absolutely have to sleep with a pillow in between my legs, otherwise my hip, like, they lose their mind when I try to get out of bed. But that is one thing I'm having issues with. I'm also still having issues with restless leg syndrome, which is a colossal pain. It kind of feels like you have like tingly feeling all over your legs, and it makes it really hard for you to fall asleep because you can't stay still. You constantly have to move your legs, and you can't sleep if you're constantly moving your legs. So that's been a big problem for me as well that I've been trying to deal with. The last symptom that's cropped up lately, which I don't remember being as bad the first time around, is shortness of breath. I've had some issues with shortness of breath, basically not only when I'm just walking around, but also when I am lying down, even on my side. Obviously when you're on your back, that is the worst, and you definitely will feel shortness of breath, but I've felt shortness of breath and dizziness just in terms of walking from point A to point B, if I get overheated, if my daughter's laying in a specific way. So there's a lot of different causes for feeling shortness of breath, and that's something that's cropped up a lot recently. And I know it's only gonna get worse because I just have less space for my lungs to expand in me right now. So I know that's something I'm just gonna have to deal with. The last thing I wanna mention is what I'm doing to prepare, because I'm starting to get to the end of the wire here, and it's starting to be a point where I need to actually start really nesting. So for me, I've been washing all of my new daughter's clothes. I've been trying to keep organized. I made a nursery card. I'll actually post the video up here if you want to see what is in my nursery card, but I'm trying to basically prepare for if I were to go into labor at the same time I did last time. So I'm trying to make sure I have everything, all of my ducks in a row and everything set, and all of my pumping supplies clean. That's something I'm going to be doing in the future, is cleaning all of my pumping supplies, because my first daughter I wound up exclusively pumping. My second, it could happen if she's not a good nurser. I just don't know. I have no idea. The other thing I'm trying to do to prepare is just make sure that I have everything set up in my daughter's sleep area. Everything is ready there, and my hospital bag is packed. I did already pack my hospital bag because, like I said, went into labor at 34 weeks and I want to be ready. The only thing I need to throw in there now is snacks, which my husband ate some of recently. They were supposed to go in the bag and he ate the snacks. I caught him eating the goldfish. But that's the last thing I really have to do, is kind of make sure that I have everything set up and ready to go, and that my family's on standby to come watch my 15-month-old while I'm in the hospital. So that's kind of where I'm at right now at 32 weeks. I'm kind of in nesting mode. I finally just finished my school year, thank God. I'm really excited to actually be off and be able to relax and hopefully make it all the way to full term this time. How are you feeling? Do you have different symptoms? Do you have extra symptoms? Are you excited? Are you nervous? Tell me all about how you're feeling about your pregnancy. If you like this video, give it a thumbs up and consider subscribing. I do lots of new content on new parenting, as well as educational content for developing a child's mind, and I would love to have you stick around. I appreciate you watching, and I'll see you next time. Take care.